my mother just had her annual mammogram and it was clear. But it turns out she was high risk and her OBGYN never talked to her about it. And she had extremely dense breast tissue, something her OBGYN never talked to her about. And what that meant was that the annual mammogram she was doing was never going to find her breast cancer. So when it was found, it was in every organ, and she was gone 7.5 months later. Fast forward, and I found lumps in my breasts. And 1.5 years after my mom died, I was diagnosed with breast cancer at 24 years old. So I became passionate about early detection out of a need to not see any more of my family members die of cancer, out of a need to not see any more friends die of breast cancer. And the hardest thing for me to grapple with was there were things that could have been done. In the United States, we built a healthcare system focused on disease and treatment of disease. And so where's the opportunity to radically change our healthcare system? It's with prevention and early detection. There are actionable things that can be done to prevent breast cancer, specifically, because that's my expertise. There are actionable things that can be done to ensure an early detection. But instead, we have a one-size-fits-all screening program for women in the United States. And that just doesn't work when you may have a high risk of breast cancer, or you have extremely dense breast tissue where a mammogram is not going to identify your breast cancer. And so where I think there's a huge opportunity in the United States is really to focus and shift our energy from disease and treatment to prevention and early detection.